first of all, I think that everything that Randy said really resonated. We could talk all day, both about some things that we yet need to do and some of the things that we're already doing. But first with the patient story, there was a gentleman in the hospital who had an IV bag hanging, as is common in hospitals. And his wife noticed that the IV bag on Tuesday morning was different than had been on Monday evening. And she brought it to the attention of the team. So by the team, I mean the residents and the attending physician came into the room. So I want to kind of pause right there and think about how we might have reacted in the past to that. So the family member questions the physician, said, I don't think that's the right IV. So, I certainly in my career have seen residents that said, basically, you don't know what you're talking about. You're just a family member. Who are you? You're a lay person. But I'm happy to say in this case, the resident said, well, let me look into that because I'm concerned about it. She raised the concern. And what the resident did was found out, that not only that it was the wrong IV solution, but also looked into why. And sort of really asked the question, and we then delved into say, what was it about this process that led us to hang the wrong IV bag? Happily, this patient wasn't harmed, but I really wanted to raise the fact that a patient concern, helped us to learn to be better.
And let me just tell you, medical school has changed. I go to stand up and I have to hand them my slides, and they all have their Starbucks, and they all have their laptop computers. And they're really engaged, and I was very proud that nobody fell asleep at the end of my 2 lectures. But really what's exciting is we are starting to have this conversation. We are starting to talk about things that in reading Randy's book, we all as physicians took for granted. The fact that your son came into the emergency room in the middle of the night and nobody really jumped up to save you, we see that. But for the first time, we're not only talking about quality, we're starting to talk about the patient experience. And what really struck me as I read your book, and as certainly I enjoyed your talk, is that there have been leaders in the field of quality. And one that stands out to me is Sorrel King, who, if you don't know the story, Peter Progonos down in Johns Hopkins started to really write about quality, and it was an 18-month girl that got the wrong medicine and died. And Sorrel, her mother, has really made it her effort, her mission, to go on and increase really our high reliability concepts that we have in St. Vincent's and Bridgeport, and we're moving across the state with the Connecticut Hospital Association. We're really leaders in the state, in the country in that. I think we have the opportunity with you, Randy, you can lead us through really elevating the patient experiencing and making sure we all recognize how important that is, and I applaud you for that.
One of the things I will often say is that we know more about, if you think Procter & Gamble doesn't know more about the toothpaste all of us use this morning than we do about our preference for healthcare, you're kidding yourself. Now that doesn't mean it's easy or to figure out. I mean, we're still struggling to figure out what's the best form and way to contact a patient. Is it smartphone? Is it email? Is it a phone call? And we know as health plans we call a lot of you. And we know a lot of you don't really pick up, but that's another story. So, there's a lot of opportunity. I think, maybe your open comments, I could agree that we have a long way to do. And it's really an interesting thing, as a carrier, we've got to figure out how increasingly we have a customer that isn't through a group purchaser of healthcare, but actually more directly to an individual. So it's the direct-to-consumer shift is here. The cost, a conundrum. But also, ultimately, a health plan's job is to support the doctor and patient as they figure out what's best for them at that point in their journey. That sounds really easy, but as you witness and experience, it's extremely hard because there's a lot of gray.